Did you know that Kinky Wellness is integral to your self-development? Hi, welcome to the Partition, home of Kinky Wellness, the ultimate destination to explore the integral connection between kinky wellness and your personal development. I'm your host and kinky wellness coach, Dana Shergill, and each Monday I bring on a special guest to dive into specific aspects of kinky wellness. From unconventional practices to thought-provoking conversations, I'm here to break down barriers and redefine the boundaries of wellness and pleasure. Don't forget to join me for my solo shows on Wednesdays, where I explore even further into the multifaceted layers of kinky wellness. So let's strip away the shame and taboo together and have an open conversation about it. Hey, and welcome back. Today, I'm excited to introduce you to sex therapist Micheal Vigorito. He is the co-author of the 2018 STAR Health Professional Book Award for his book, Treating Out of Control Sexual Behaviour, Rethinking Sex Addiction. As a psychotherapist, Micheal provides individual, couples, and group psychotherapy for a range of sexual and behavioral health concerns, which include consensual sexual problems, relationship and sexual dissatisfaction, and sexual disorders. However, in this episode, Micheal and I will be focusing on the out of control sexual behaviors and erotic identity development concepts. So without further ado, let's welcome Micheal to the show. Hello, Micheal. Welcome to the show. How are you doing today?
I'm doing great. Thank you for the invitation.
Oh, well, I'm very excited to talk about this topic of out of control sexual behavior. But before we jump right into it, I'd love for you to explain the definition for the listeners.
Absolutely. So the definition that I have in my book talks about how persons' consensual sexual urges, feelings, and thoughts feel out of control for them, right? So it's a definition that's based on someone's subjective experience of their own sexuality. It's not meant to be a diagnostic criteria. It's really just meant to be kind of a descriptor of that moment that allows people to get curious about all the factors that can contribute to why someone might feel out of control.
Well, what I like a lot about your work when it comes to out of control sexual behavior is your importance of integration, which is something that Kinky Wellness really puts an emphasis of stop like splitting or eliminating those avenues for it. And it's really about getting to know and kind of work with that side of you.
Oh, I love that. One of the things I tell my clients is that I don't want my clients to have an adversarial relationship with a part of their self themselves, right? And particularly an adversarial relationship with their sexuality or erotic selves, right? That's when we have some of the defenses that can create internal splits. That's when really people can feel disoriented and feel dysregulated. So my work is to hope to integrate their sexual and erotic selves into their self-concept so they can find ways to express their sexual behavior in a way that feels both pleasurable and responsible.
Well, absolutely. And I think a big part of that in reintegration is kind of it's just being more honest with yourself and understanding that it's not going to happen overnight. And even when it comes to certain interests and kinks, we might not know where exactly it's starting from, but it's just about going down that path of maybe finding out something about yourself that maybe you haven't remembered or you don't remember anymore.
Yeah, one of the words that I use a lot when I'm training other clinicians is curiosity, right? I want to facilitate a process where my clients can be curious about their own sexual and erotic selves in a way that's not defended, in a way that doesn't trigger disgust or shame. That way they can get to know that part of themselves more. They can understand, because I work a lot of people who have problems related to the sexual behavior, so they can learn to understand the functions of this behavior, because it's usually a solution to some type of bind that they're in. So I want to understand what that bind is. I want to understand their own sexuality in the context of their current life and understand what they're trying to solve for. We can't do that without being curious and raising people's self-awareness about what it is that they're trying to achieve and what feels pleasurable for them.
Well, I agree with that because I find when people aren't as curious and aren't going or willing to go down that path, unfortunately, they swing on the very far opposite and it comes out in very extreme negative ways that is just amplified the thing that they were ignoring in the first place.
Agreed. I mean, curiosity, I find can be helpful in so many different ways, right? I think the example that you just gave is one. Many people are coming to me with sexual habits that developed over time. And one of the first steps of trying to change or alter a habit is raising your self-awareness to be curious, because a habit is kind of this automatic behavior. When you think about people's relationship with your phone, right? How many times do you reach for your phone without realizing you just reached for your phone, right?
Mm.
That's a symptom of a habit. So my hope is to raise people's awareness, to be curious about that moment, to slow it down so they can hopefully make intentional decisions about what is it they want to do with that phone. What is it they're trying to, what feeling are they trying to regulate? Because a lot of times it could be about boredom or stress or anxiety. I want people to take a breath, be in the moment, and then make an intentional choice. And if that's grab their phone, then great. If that is go take a walk, that's great too.
Well, I agree that it's about kind of slowing that moment down. I do find that sometimes there are steps entering kinky wellness. One of them is conversations about where you're looking to go and your desires for it. But I do find that someone that may not be so educated, they just nosedive into it without actually understanding some of the consequences. And it is kind of about going slow and seeing where it goes. And that might not be intercourse right off the bat for the first time.
Yeah, no, I encourage folks to be mindful in those moments just so they can move with intention. Oftentimes, I'm trying to think of an example where someone might discover kind of a new pleasurable sexual experience. And as you said, they're like, oh my God, this is fantastic. So they go like 0 to 100 in a matter of 2 seconds. It's like, okay, that's great. We love that this is pleasurable. And we want to make sure that we find ways to express yourself that's both pleasurable and responsible, pleasurable and safe for you. So we know folks can go a little too fast at times, and that's when they can create some injury. So I want people to just to think and be thoughtful, I should say, about the type of sexual expression that they want to engage in.
Absolutely. Now, one of the big words that you use is feel like you're out of control. And I think this is a little bit
Mm-hmm.
when people want to put that out on the other side. And you do quote Marty Klein a lot, that quote that says, just because you feel out of control doesn't mean you are. And I
Mm-hmm.
find that people can be reminded that you can create within like your sexual life and your sexual experiences where you can feel out of control, but subconsciously you are very much in control of that environment. And it might be kind of a balance to those moments.
Correct. That's my approach is always attempting to help people feel empowered and think about the choices that they are making. So that example that Marty Klein gave, or that observation, is so poignant because sometimes people will come to me like, "Oh, I feel out of control. I've been doing this, this, this." Then I'll just take moments like, "Okay, well, tell me about when you stopped, or tell me about the times that you aren't engaging in this behavior in a way that feels out of control for you." And it automatically kind of gives them a shift. It's like, oh, that's right. I did stop. Let's get curious about how that happened. Or that's right. I did go to work today and engaged and participated at work. I wasn't engaging in this behavior. It's like, how did I do that? These are all choices that people are making. So I want to center the locus of control within the person again. So much of my language is targeting and trying to understand the client's motivation and choices that they're making in these moments.
Mm-hmm. And the motivation, I think, is the biggest part here because it comes back to self awareness and kind of
Mm-hmm.
understanding where that is. And I do believe that once you become self aware in your sexual life, I believe that it's a lot easier to become aware of everything else because it's so integral to how we are as a human species. But when it comes to out of control sexual behaviors, are there other types of treatments that you encourage as well as reintegration?
Well, remember the kind of the phrase out of control sexual behaviors. I almost describe it as like a placeholder, right?
Mm.
One that doesn't insert any type of diagnostic sounding language, right? That can sometimes be a distraction, or it inserts what we call kind of an etiological mechanism, right? Like, so if I say I'm sexually compulsive, then compulsion or compulsivity has a particular clinical definition. It's a behavior to help regulate anxiety or regulate obsessive thoughts. And that could be true for this person, but I want to step back, use a phrase that just allows us to deconstruct what's happening for them. So that's where out of control sexual behavior comes in. It's just kind of this placeholder so we can get curious about those factors that are contributing to that feeling. So one of those factors could be an underlying or pre-existing psychiatric condition, right? That's either untreated or undertreated. Much of the research in this area points to what we call kind of comorbidity, right? That people are presenting feeling out of control, but they also have symptoms of depression or an untreated diagnosis of ADHD or bipolar disorder, PTSD. So my job as a clinician is to do a thorough assessment to see, is like, all right, is this sexual problem actually a symptom of this untreated condition? So if I'm just targeting the sexual problem without, say, targeting the underlying condition of ADHD, I'm going to create a treatment plan that's going to be less effective, right? And likely stigmatize the person for these sexual problems because we're kind of focusing on that without addressing the underlying major depressive disorder. So the approach will first, my approach first, like I want to do a thorough evaluation and then treat those underlying conditions if they are present. So, how we treat PTSD is different than how we treat ADHD, which is different than how we treat major depressive disorder. So it's hard to say kind of what kind of a blanket approach is, except to say, I want to do a thorough diagnostic and to make certain that I understand my client's clinical picture.
Absolutely. Thank you for the clarification. Now, something else that you do that's very prominent in your work is the erotic identity development as well. And I was wondering if you
Mhm.
could explain a little bit of the framework that works around that.
Yeah. Erotic identity is similar to sexual identity, right? So let me just define some terms if I can. So sexual orientation, it's like that's the to whom we're attracted. Erotic orientation is more like the what, the themes, how we feel turned on. I find that people understand that concept of orientation. So I try to borrow some of these terms to help understand that we have these capacities that are persistent, they are insistent, they are typically consistent, and that I want my clients to understand that part of themselves and then fold that into their self-concept. So similar to gay, lesbian, bisexual folks who have identified their sexual orientation, they likely had to evaluate the kind of the life script that they were given, tell them who they were supposed to be, and then they realize, oh wait, I'm a little different. So they have to kind of grieve that life script, accept who they are as a sexual being, and then communicate that to others and develop relationships around it. That same identity arc that I just described works with or applies to one's erotic orientation. So when people's sexual systems come online, typically around puberty, they realize like what turns them on. They may have been told what's supposed to turn them on, but it could be a little different. So they have to come to a level of acceptance like, oh, this is part of my eroticism. This is going to be with me. So they develop words around it. They hopefully then communicate it to other people so they can then develop relationships where that is integrated. So it's a similar identity arc that I think it's helpful for people to understand that it's up to them to find the signal from the noise, right? That you can be turned on by almost anything that's out in the world, but what turns you on? And is that persistent, consistent over time? And if it is, that's likely part of your erotic orientation. Let's fold that into how you understand yourself so you can then express in a way that feels both pleasurable and responsible.
I absolutely love this concept. And I find that more information on this should be really going out worldwide because it must be very hard to create an erotic identity development when we're not allowed to talk about these certain erotic identities
Mhm.
in the first place. And it's kind of like we can't talk about it, so we can't build on it. And that's where I feel like a lot of these problems might be stemming from.
Well, getting it distributed worldwide, I'm going to put that onto you.
Yeah.
This is your platform, and I hope you have a worldwide reach because I think I agree. This is a really
Yeah.
important topic. So I'm happy to help you spread the news about this concept.
Well, absolutely. And I think that when it comes to eroticism, we have either just the what we've been taught, which is kind of pornography, and we've kind of walked away with the big picture of how depth and big this really can be. And
Mhm.
so it can be very intimidating for someone to even approach this topic.
Yeah, I mean, I don't know where people have become prepared to have these conversations or where they get prepared. I mean, in the US, right, we have a pretty fractured sexual education system. So I'm frequently the first safe, non-judgmental space where people can put words to what turns them on. Because they have been so ashamed by it, they've been defended against it because they fear rejection, either from their family or from potential romantic partners or potential sexual partners. And what I try to orient people and kind of normalize is that not much, many of my clients, not much in their life prepared them for these conversations. That wasn't, sex wasn't discussed in their family of origin. It wasn't discussed among their peer group. They just did like a deep dive into the internet, and that can be filled with a lot of terrible information around sex and sexuality. So when they finally, these clients find me, it's usually unfortunate because there's some type of sexual problem that kind of triggered this idea. It's like, maybe I need to seek help and talk to a therapist. But I'm glad they find themselves to me so we can finally have this conversation in a way that can help them kind of unlearn all of these negative concepts about themselves and about what turns them on, so they can find ways to express themselves in a way that's both pleasurable and responsible.
Absolutely. Another concept that you have is something that you talk about with quick arousal. And I was wondering if you have any steps of how to help someone integrate or fix if you have something with quick arousal.
Quick arousal. That phrase I'm not familiar with. Can you say
Oh,
more?
I heard on a previous podcast, I heard you
Okay.
talk about quick arousal, which is something with your out of control sexual behavior. And I was wondering if you could explain a little bit
Got
further
it.
on
All
something
right.
that might be able to help.
Got it. That's an interesting phrase. I was like, I think I know it. I think I know what I was talking about back then. Okay. One model that I find can be helpful in framing this is called the dual control model of sexual response. And here they talk about that we all have this capacity for sexual excitation, and we have this capacity for sexual inhibition. And the capacity is going to be unique to the person, right? And this person's sexual response is going to depend on the balance between these two systems. So some people have a very quick arousal, very sensitive gas pedal that they are coding kind of stimulus in the world as they're moving through, like as sexual. So it doesn't take them much to get turned on. Other folks, if you think of the inhibition side of the house, right, have a very sensitive break, right? That even though they may be getting turned on, something can be entering their mind or entering their environment that really taps on their break, that slows them down. So oftentimes, the clients that I see have a couple different profiles. I could be seeing someone who has a very sensitive gas pedal, right? They are quick to be aroused. They are quick to feel sexually excited. So they are managing this constant pinging into their mind of something sexual and arousing. So that's one profile. Another profile could be someone who has an average capacity for sexual excitement, but they have a very sensitive break, right? And so they're constantly being frustrated, being interrupted in their kind of flow towards sex. And they might do things that kind of disinhibit themselves that can become problematic. And this one example could be where drugs and alcohol can come into play. So this person really wants to be sexual, but they have this really sensitive break, and an easy way to disinhibit oneself is with drugs and alcohol. And as we know, that can also then create problems down the line. So I'm always listening for people's capacities, because again, one of the things I like about that model is that it doesn't stigmatize people for having a sensitive gas pedal, for instance, or a sensitive break, right? It's like, let's understand what your capacities are so we know what we're working with. There's nothing in psychotherapy that we can do to change someone's capacity for arousal, but we can help people disinhibit or inhibit themselves to kind of balance their capacity for excitation. So in psychotherapy, we focus on the inhibition side. So if someone has really high inhibitors, that could be related to anxiety. So those interventions to help them disinhibit could be around managing their symptoms of anxiety that keep them present, right? So if someone is really worried about STIs, or they're really worried about their sexual functioning, then we know that cognitive therapy can be helpful in managing their anxiety. Or if someone really stand on their brake, right? Like it takes a lot to slow down that train. Psychotherapy can also help increase their ability to transcend the moment, to create mindful pauses as a way to slow down their process toward whatever type of sexual behavior that's been creating some problems for them.
Thank you. Thank you for that. I find that this whole topic of out of control sexual behavior very interesting, because we live in a society that almost encourages people to go and be out of control. And I feel like there
Mm,
might be some people that might feel that they're out of control, but really they're not. And some people that might think that they're in control, because they're following what this society model is, but really they're out of control because we're not using our intention when we're having sex anymore, it seems, or not
Hmm.
as much.
Yeah. It's a good observation in the sense that some of the research on this supports what you just said, as far as some of the people who might self-identify as being sexually addicted or compulsive weren't actually having more sex than people on average, right? So it makes you wonder, like, what is happening, right? So one of the other conceptualizations of out of control sexual behavior is people who have a values conflict about what they're doing, right? So they, even though they might be, say, masturbating once or twice a month, because they have such judgment about what that behavior, and they feel like they couldn't stop themselves in the moment, they've then identified themselves as sexually addicted. And one of the predictors of that type of what we call moral incongruence or values conflict is religiosity. But religiosity is not the only way people can feel out of control or have a values conflict about what they're doing. So one of the things that is challenging for clinicians, right, is that they can't just, it's one of the things we diagnose people who have problems with alcohol is that we ask how many drinks you have during the week, right? And if you're having over, kind of what's the recommended limit, it's like, this could be problematic. You can't really apply that to people in this area because they may, as I mentioned, kind of having, they may be masturbating once a month, but because of that values conflict, they may come in really distressed about what they're doing and want therapy to help them. It's like, I don't want to ever masturbate again, or I never want to think about this thing when I masturbate. It's like, well, that's a bit of a dilemma for us. So I want to be able to create the space for them to identify what these values are. What is their vision of sexual health? Is there room to evaluate their value system to see if we can't lessen some of that moral incongruence? But yeah, like frequency alone, or amount of orgasm someone has in a week, it doesn't really predict someone's distress around this issue, right? We have to understand their sexual behavior in their context with their values.
Well, I like this point because value conflicts, when we have a culture of purity, it can be the bar can be very set, very low for this type of
Mm-hmm.
behavior. So, again, really assessing like the individual and how they were raised and what their influences were. But I feel like this is an ever growing topic because with the rise of ethical monogamy and new
Yep.
education that's coming out and kind of the fads, I guess, they're going through a little bit somewhere here and there.
The
So
cultural shifts.
yeah, the cultural shifts that are happening. So we're going
Yeah.
through a values conflict here that I think is getting bigger and not actually getting smaller.
Correct. Yeah. I mean, I can frame this in more kind of clinical concepts, right? Part of what I'm trying to integrate into the book was this concept of self-regulation. Like, how do people change or alter how they feel, how they prolong or amplify how they feel, or how they just align their behavior with their own values, right? And any type of problems in that process is usually what people are coming to me. It's like, I feel out of control. So I want to think about this from a self-regulation perspective. So I think about, all right, so if your problem is related to aligning your behavior with your values, I need to know what your values are. And I often have conversations with my clients like, all right, I look at values sometimes on a spectrum of like permissive to rigid. And where are you falling? Because if we have permissive values, then someone could just be blithely moving into sexual situations, I use it kind of unmindfully, and they could get injured. If someone has kind of more of the rigid sexual values, they may be setting themselves up for failure because they have such high standards of what they should be doing. One common example that I give people is this concept I call fidelity of thought, that I have a value that I can only lust after my romantic partner, right? And anything short of that or anything outside of that is infidelity. So what a high standard that is. Because that's also just not how our cognitions work. We have intrusive, random thoughts all the time. And if I think about someone else outside my relationship in a sexual way, and I'm either distressed by that or makes me believe that I'm not being a good partner, right? That's going to have significant emotional consequence on the person. And it could be, in my mind, terrorizing, right? Because at any moment, I could have this sexual thought as I'm walking through the world that is about someone that's not my partner, right? So yeah, so I want to look at values and I put that on that spectrum to help people understand. It's like, all right, these are the values that you are holding. what are the emotional consequences of this? And is this something that you want? Can we evaluate the consequence of holding this? And then again, I mentioned earlier, like I want to empower them to make choices and to feel motivated by this. And then I put it back to them. So what do you think about this? How does this feel to you? Is this a value system that you want to hold, right? Because I don't want it to have to come from me. I want it to come from my client. That's really the main way that we can sustain change over time, is if it's coming from my client.
Well, even with your fidelity of thought, it's impossible. Like to your point, that's
Agreed.
literally impossible.
Yeah.
And I think with at least what I see with people that enter in kinky wellness, I think that lucky enough they've expanded that definition because they understand that it's impossible to control your thoughts inside. But that's incredible pressure for people. And it really changes that perspective of what's cheating in some relationships. And we've like narrowed it down so much that it's only going to start like fracturing your relationship because you're
Yeah.
going to combust from all that pressure.
Yeah, and I think Esther Perel talks about this in such eloquent ways, that we just overburden our primary relationships because they're supposed to be our, best friend, our lover, kind of our co-parent, and the primary source of our erotic fulfillment. Like, that is a lot to place on one relationship. So my hope is for my clients to at least give themselves a break somewhere, that they can give themselves a little kind of freedom of the mind to have an internal fantasy life, kind of a way in which that they can continue to grow erotically, and then maybe bring that into the relationship, have conversations around it, whatever they want to do with it. But if they're just pouring it into this one relationship on all these fronts, I fear that it's just going to overburden that relationship over time.
Absolutely. And I do feel that when it comes to like our sexual wellness and kinky wellness, it's a very good opportunity and playground to play within those ethical and consenting boundaries of letting these kind of experiences go, because our soul really does want to experience all the spectrum. And I
Mhm.
think that there are people out there that do think that life should be kind of structured in the boxes. And I don't really blame them considering our education system, but
Mhm.
it's about reframing that and inviting curiosity and imagination back into play here.
I agree with that completely. No, but
Absolutely.
I don't know if I have anything to add to that. I just like that. I feel like that is the work. And you did say something earlier in that statement that we haven't really talked about, but you talked about like an ethic around sexual expression, and that is also something that's core to my work. My co-author and I apply what we call the sexual health principles to treating out of control sexual behavior, and it's principles that were developed out of publications from the World Health Organization, the Pan American Health Organization, when they're talking about sexual pleasure and responsibility. The reason why I cite that is because I don't want you to think that this ethical framework just came from some dude, practicing out of Washington, D.C. It's like, this is what I came up with, right? I was like, no, no, no. It comes out of a kind of a consensus body of work from medical professionals and psychologists and researchers. And it was a great discussion about what is involved in responsible sexual behavior. And these principles were stuff that you just mentioned, right? That it's consensual, it's non-exploitative, right? People aren't leveraging power and control to have sexual access to someone because it corrodes consent. It's protected against STIs and unintended pregnancies. Honest, right? There's an honesty with oneself first, that this is what turns me on, this is what doesn't turn me on. And then, so you can then be open and honest with your partners about the same thing, right? It helps people understand what they're consenting to, right? If I can be honest about what it is that I like and enjoy. And there's two more. There's shared values. This is the part of sexuality is about meaning making. I always like, I joke, it's like touch means different things depending on who's doing the touching and where they're doing the touching, right? Like if my elbow touches your shoulder, that means something completely different than if my hand touches your butt.
Yeah.
Uh, and so I want to acknowledge, like, we place a lot of meaning on touch. And so let's understand what the meaning of this touch is for us. Is this sexual activity relational, procreational, recreational, and is it happening in that overlap? And again, it helps people consent to what it is that they're doing. And then the last one is mutual pleasure, right? Is everyone's pleasure considered? Everyone in the sex act, whether it just be me or we or three, everyone's pleasure is being privileged, right? Because in society, sometimes we privilege someone's sexual, some groups of people's sexual pleasure over others. And so I want to make sure that pleasure is equalized and considered among everyone who is engaging in that.
Absolutely. And I think even extending a little bit further, I think one of the pitfalls of BDSM and kink, at least what I see, is that some people can take what their sexuality is and just like create their entire identity around it. And I think a little bit of what I want Kinky Wellness to show is like, yes, sex is very important, but it shouldn't be that all consuming. You have other things about you that what makes you a full, well-rounded human. Like you have other
Sure.
interests.
Yeah, and I mean, I like that. And I was just thinking, I was like, oh, that's interesting. Can I push back a little bit?
Yeah, yeah.
Yeah, yeah. I was just thinking, I was like, what if someone was like training for a marathon? Would we say that to them too? Is like, oh, I wish you would have other hobbies, like because it takes up time and it can be really, really time consuming, and they're really focused on it because it changes their diet and they're exercising and they're always running, right? Like it's interesting. Would we say that about someone who is training to be a tennis player? Right. But then I also appreciate balance. So it's like, but yeah, because people who are like really training for to become a tennis player, like tennis star, and afterwards are like, God, I neglected all of my relationships. I neglected all of my friendships. Right. And now that like their pro life is over, they're like trying to rebuild because they noticed they were so focused. So yeah, I was just playing with that idea. It's one of the things that I do with my clients when they come in. It's like these values, like, oh, I shouldn't really be interested or focused on it. And I was like, well, let's shift it out of the sexual context and to say, all right, if instead of having sex with a person, let's say we were always like, doing doubles tennis with this person, and apply that same rationality or ethic and kind of see what shakes loose. So I know I was just playing with that idea with you.
No, I
I hope that
appreciate
was
that. Thank you, though.
okay. Hope that was okay.
No, that's great. I actually like that. I think that when it comes to sex, yes, it's also giving focus on it. I think some people will what we brought back to some of these reasons why it can be out of control is because they ignore it. And so yes, it's
Mhm.
about balancing and bringing in that your sexual health should be on the spectrum of your health care as well.
Agreed. Yeah, and I was only playing with the idea like I will typically fall back to the idea of balance. Like I want to make sure that people have a diverse portfolio of what is supporting their health, right? From their own, biological foundations of eating, sleeping, exercise, but also socially, and feeling like they've got purpose in life, right? So that yeah, it's definitely an approach toward balance. So I actually agree with you more than I disagree.
Wonderful. So if somebody wanted to say maybe they were considering they're reassessing, they're doing some self-awareness, maybe they think that they have out of control sexual behaviors and they came to see you, what would their expectations be like when they're walking through some of your sessions or mentally prepare themselves for?
Oh, that's a great question. I mean, similar to what I mentioned before, like I try to give them as much information up front so they're fully informed of this process. And I am assessment heavy. Like I want to gather information because I want to know this person. I want to know the behavior in the context of their life, right? Because that is going to let me know what the function of this behavior is, what binds that they are in, and where this behavior is a solution to that bind. So it could take anywhere between 4 to 8 to even 10 sessions as we're just collecting information and processing the disclosures as they go along. Because most likely they have some either shame about what's happening and they've some avoidant defenses around it. So therapy is the opposite of an avoidant defense, right? Like it is going right for it. And this might be the first time they've really sat down to examine themselves or to put these thoughts and experiences into words. So whenever that happens, I slow down and process and talk about what feelings just came up for them, help them label it and express it. And particularly, I primarily work with men, and men aren't well socialized and be able to mentalize their emotional well-being or emotional experience. So I want to make certain that they have the labels to be able to identify and express their emotions. So that's partly one of the reasons why this can take so long, is because I am constantly stepping out of the information gathering and processing what they've been talking about with me. So at the end of that, and then I talk about their clinical picture, kind of talk about how I understand their work, because unlike the medical profession, I can't just take labs or do run an X-ray and point to where the broken bone is. And like, oh, that's what we're trying to fix. I have to gather this information, then talk to them about how I understand their clinical picture, and in a way that checks in with them. Does this resonate? Does this fit with how you understand yourself? Is there something I missed, something you disagree with, right? Uh, and once we get through that, make changes to whatever the picture is that they would like to have changed. So we're all kind of on the same page as this. I call it my a shared understanding of their work, and then we create a treatment plan, right? I call that their sexual health plan. So we get clear on the behaviors that they're trying to address or discontinue, and then focus on, all right, if this is what you're wanting to stop, understood. Let's talk about the things you want to engage in. Let's talk about your vision of sexual health, where you want to move toward, so we can not just, implement a diet, right? What we're trying to do is have a sexual expression that feels responsible, but it's also pleasurable, right? I feel like it's one of the few health domains where pleasure is center. Because what I tell people is like people aren't motivated to follow a boring sexual health plan. Like no one is going to want to do that. So yes, let's get clear on what some of the things you're trying to manage and control, but let's look at what is going to be motivating for you, what is going to be pleasurable for you. And then treatment from that point forward is just helping them maintain their sexual health plan.
I think that's really well to know. I think some people, when we enter health, we can be overwhelmed because we don't know how long it's like. There's no time period. You can't really say that, but we aren't aware of what it entails. And so people can shy away from it altogether.
Yeah. Yeah. And I feel like, and it can be really overwhelming for folks because they have been avoiding this issue for much of their life, right? And so the cost of the status quo has to be greater than the cost of change, right? And usually that happens when some type of crisis or some type of problem erupts, either in the relationship or at work, or something really challenges their self-concept and it's overwhelming. So I'm often seeing people who are coming in because of that crisis, right? Or something just happened that they can no longer avoid looking at this anymore. But they don't know how to do it because they've been avoiding it so long, right? They don't have the words for it. They don't know where it is safe. They don't know so much. So like I try to be as slow and deliberative and upfront about what this is going to look like, because these are also really vulnerable moments for people that I don't want them to feel safe, right? I don't want them to feel like that this is going to go too fast or too far, or they'll be exploited in some way, because this is a really sensitive time for them. So I tried to be as upfront and clear as possible.
Absolutely. Now, you mentioned shame being one of the feelings that you talk about in your
Oh
practice,
yeah.
but you also mentioned grief. And I was wondering if you've ever heard the term sexual grief. I had a woman named Edie Nathan previously on the show,
Mm.
and she talked about how a bad kiss to a bad date could give you a form of sexual grief. And I'm wondering if that shows up a lot in your practices when you're working with someone.
Oh, that's a great concept. She actually I just presented some of those ideas at the STAR conference
Oh,
that was
oh,
in
she's so
Toronto.
good. Yeah. Oh my
Yeah, she was great. I
goodness.
really enjoyed her. Where I see grief, I think I kind of alluded to it earlier around the sexual and erotic identity development. Part of that process, right, is trying to accept who you are sexually and erotically. But when someone's sexual systems come online, they've already internalized all these messages about sex and already have kind of a vague idea of how they're supposed to be, right? I call it like their life script. And they may be really invested in it. They may not want to change it, but it's not congruent with who they actually are. So that acceptance process is a grief process. And grief is an acceptance of change. So even when I'm changing my self-concept, right, that's a loss. And I have to grieve that loss so then I can feel fully integrated or kind of accept who I actually am, what my capacities are, what turns me on, what I want erotically.
Yeah, and I think a lot of people don't use the term grief, and this also falls with shame. It
Mm.
doesn't have to be some massive event to make you feel an overabundance of shame if it's something small and repetitive over and over again.
Yeah, I think people focus on grief or like a lot around death of loved ones, which is a form of grief, which will trigger a grief process. But what I tell my clients is that whenever there is change, there's loss, and whenever there's loss, there's grief, and that is just a description of an acceptance process that they're going through. And change could be anything, right? It could be I moved. It could be my romantic partner, their health has changed and we can no longer have sex in the way that we used to, right? That's a change that equals a loss that they have to grieve, right? So I try to expand the understanding of grief because I also think people understand grief as a process, right? Because of our focus on grief through death, uh, people get it, right? They're like, oh yeah, I'm accepting the change that has occurred in my life because this person that I loved is no longer here, right? So it's an acceptance of that loss. So we can then apply it to other losses that they've experienced and other losses that they've experienced in their sexual kind of the realm of sexuality that's in their life.
Absolutely. And thank you for explaining a little bit more on what you see with the grief. So, what do you see primarily when it comes to shame within your practices and clients? Is there something that's repetitive over and over, like certain characteristics of shame, or is it just kind of an over general feeling of it?
Oh, I could talk about shame all day. So can I define it first? Right.
Absolutely.
One of the
Absolutely.
definitions that I liked, I think was that of Tompkins' work. He was a psychologist researcher, and he talks about how shame is the felt sense of being seen in an extremely diminished way, right? I like that definition because it then makes sense to why shame defenses are all about not being seen, right?
Mm.
And we have shame defenses really early on. Think about if you have young children in your life when they feel embarrassed, right? What happens? Like they turn their face away, or they hide behind their parent's leg, or they put their hands in their head in their hands, right? These are all avoidant defenses. And adults have similar avoidant defenses to manage their shame. And that can look like secrecy, right? That could look like not disclosing things that they feel embarrassed about. So shame can become attached and coupled with elements of person's sexual and erotic orientation. And when that occurs, when they don't want to feel that shame, they defend against it. They're also defending against that part of their sexuality, right? So my hope is I want to decouple the shame from their sexual and erotic interests, right? So they can find other ways to relate to that part of themselves. And it's not to say it means that they have to express themselves, right? I just want them to be mindful about what they're doing. And if they choose for whatever reason not to express them, that's fine. But it's not just because they are trying to defend against shame or kind of split that part off of them, right? One of the things that I often see for people who have a lot of shame around their sexual erotic interest is they come into therapy wanting me to excise that part of them, right? What we call in the book an eroticectomy, right? That can you come in with some type of melon baller and just kind of scoop this part of my sexuality out of my being, so I don't have to worry about it anymore, right? One, we don't know how to do that. Two, to try to do that is akin to conversion therapy, and that is harmful, right? So I have to disappoint my clients up front, right? And say, I'm sorry that this is not something that we are able to do. And if I try to do it, I would likely injure you. And help them, again, going back to that informed consent model, it's like, this is the limits of what therapy can do. Is this the type of work that you want? Because what I can help offer you is to help decouple that shame from your sexual and erotic interests, to integrate that into your self-concept, right? So you don't have an adversarial relationship with that part of you. And then together we can determine how you want to express it, right? Nothing we're going to talk about here will mean that you have to realize whatever erotic fantasy in real life, right? It can just stay within your own sexual interest, stay with your own, solo sexual practices, or even just know this about you, and that's okay, right? And I want, again, going back to that issue of empowering them, I want them to feel empowered that they can do whatever they want to do with this part of you, but that they just to attempt to destroy it or split it off is likely what's creating some of these sexual problems that they're seeking treatment for. So I'm inviting them to consider a new way of relating to that part of themselves.
And I think
And
any type of area that tries to separate someone from themselves within themselves is only going to damage the person down the line,
right,
because it's all about the harmony that we have within ourselves. And it might be difficult to once look at, but once you have someone that's able to hear you for that for what you're going through, it's going to change dramatically and
Yeah,
drastically for some, I think, just to
agreed.
be heard.
Agreed. And not all my clients want to hear that, right? And they may not pursue therapy with me because of that, because they want to hold on to this wish that they can rid themselves of this erotic interest, right? But for those who stay with me, right, we just work on decoupling the shame that has been attached to this erotic interest. And that's also the grief work, right? That they are grieving the loss of whatever life script that they had for themselves to then accept the capacities and the erotic orientation that is that they've identified as theirs, right? That conflicted with the life script that they were given. And also, like, I have a lot of empathy for these clients because, for instance, if a client has, a very unconventional sexual interest, or they have a narrow or fixed arousal, like they can only reach orgasm if they're fantasizing about a particular fetish, right? Again, there's nothing that psychotherapy can do to change that fetish. To try would be harmful. So much of it is about integration and acceptance, grieving the life script that they had, where they wish they could just be turned on by and lust for their primary partner. That might not be in the cards for them. And then we determine what they want to do with it, if they want to express it. Because the problem can be now, is how do you find a compatible partner, right? Someone who has a complementary interest, or someone has the sexual openness to engage them with that fetish, or at least even be open to the fact that in their mind, they may have to visit that fetish in order to have an orgasm, which means that they have to leave the moment. And that can be
Mm-hmm.
really distressing for their sexual partner, or really disorienting, or they can interpret it as, oh, they don't love me, or they don't lust after me, they don't desire me. And that can be really hard for that partner. So there are some pragmatic and real life consequences to having a fetish in that way, or having unconventional sexual interests, right? Because they are opening themselves up to being rejected, or struggling to find a primary, or to find a sexual partner who would be interested and willing to engage them with what turns them on.
Yes, and I actually agree with the concept of sexual compatibility because it is important because it's part of us. It isn't some other like, oh, our sexy self is something out there. Like, no, it is us. And so again, when you do find a partner that's got complementary desired
Mhm.
outcomes, then that's going to be able, you'll not only feel seen, but you'll almost feel like you're growing because someone's able to flourish that part of you again in a safe and
Yeah.
consenting way. And that's
Mhm.
really the end goal here.
Yeah, and it's always like, when I like the word compliment, right? Like, so like my client's fetish is around stilettos. Does their partner like to wear them? They don't need to be turned on by the stiletto, but does wearing them and seeing their partner get turned on turn them on, right? And that's the compliment. But it doesn't also have to be the compliment. It could also just be an openness and willingness to go there, and almost like I like to frame it as to give a gift, because it might not turn me on, but I know this is something that's really important to you. So that makes me happy, and I'm willing to engage in this to help you get turned on, to help you reach orgasm. It doesn't turn me on, but I'm open and flexible in this way, and enjoy your pleasure.
Yes, and it's giving and receiving. It's an important part
Yeah.
of our relationship. And for some reason, to not bring that concept over into your sexual, like what you do in the bedroom, that is kind of weird. You should also bring that in all avenues of your relationship, especially when it comes to sex.
Yeah, I agree. Like that's what I mean. Like sometimes I take it out of the sexual piece. It's like, all right, what if it's like we're negotiating where to go for dinner?
Yeah.
And it's like, sometimes I'm gonna go to this restaurant that is not my favorite, but I know my partner really loves it, so let's go. Right? Like, and that's okay. That is a nice gift that you're giving your partner.
Absolutely. Now, just before we wrap up, I do have one more
Mhm.
question.
Yeah, yeah.
In addition to grieving when it comes to shame, do you have a few other key points that someone might be able to work with when it comes to that?
Oh, the work there is around enduring shame, right? Because if the defense is to avoid it, right? the solution is to endure it, right? So you don't so you learn that one, it's not going to be intolerable. It's not going to kill me. I'm not going to get struck by lightning. It is okay, right? So it's almost like if you're familiar with anxiety treatments around desensitization, right? Part of what makes something phobic is that someone feels really anxious. So then we slowly over time desensitize them to what was the source of that phobia. Let's say like it's airplanes, but you also have to do it in a paced way. You can't just bring someone to an airport. You have to just first sit in a safe room and talk about an airplane. The same process happens in therapy to help someone decouple shame from that issue, right? So we just talk about it, we mentalize it. We're not even talking about engaging in it. Questions are like, what was it like to even think about or put words to it, right? That's all the process of enduring the shame to desensitize and decouple. And it's not easy work. It's uncomfortable work because obviously no one enjoys feeling shame. It's not a pleasurable emotion, but it is vital. And I hope people understand it I try to orient people to that type of work when they say, like, how do I do this? It's like, well, we have to stop avoiding it, which means we have to feel it. And oftentimes people might not be ready for that process, and that's okay. But I want to make sure that they know what they're getting themselves into. But I also try to explain that it's going to be paced. We're not throwing you in the deep end. It's going to be slow, incremental steps, so they don't feel, because flooding someone or making them feel overwhelmed is not therapeutic, right? If anything, that just reinforces the avoidant defense. So you have to do it in such a measured way that they can tolerate it and then gain confidence that they no longer need to avoid it like they were doing before.
Absolutely. Well, I definitely agree with being able to sit with it and maybe get to those steps when you get to feeling it and being with it, because it's not going to be pretty. It's not going to be easy, but
Yeah,
it's about not hiding it or suppressing it, as always, when it comes to everything. When it comes to health,
agreed.
just don't suppress anything.
Agreed.
Absolutely. Well, this has been a fantastic conversation. And for my listeners, where would they be able to find more about you?
Oh, thank you for that invitation, and thank you for this wonderful conversation. I really had a good time. You can find me on my website, michaelvigorito.com, and you can find me on that workhorse of a social media site, LinkedIn. Is probably the best places to find me.
Absolutely. Well, thank you so much for coming on again. And for my listeners, I will see you on Wednesdays. As always, stay kinky.